Hi, I want to talk to you today about a health science concept. There's this thing that happens in kind of any clinical field where we talk about the importance of dose. And the idea with most dosing is that dose should be the smallest dose necessary to achieve the desired clinical outcome. And that makes sense, right? Kind of intuitively. We want to use as much of a therapy as will create the outcome that we're looking for without using too much of that therapy. Because the more of the therapy we use, the higher the risk of that therapy are. So in my job, the variables that I would think about would be how forcefully I'm performing some procedures, how much pressure I'm using during a massage therapy treatment, how deep and how thick I'm using my acupuncture needles, how much electricity is going through those needles if we're doing electrotherapy, and on and on and on. How much rehab am I giving? And the idea here in all of these things is that we kind of want to use as little of the thing as possible. One, because we want to avoid dependence. And two, because life's too freaking short to spend all of your time in a clinician's office. Look, I'm not saying that people shouldn't get the therapies that they need. Sometimes when you're really messed up, or you're really hurt, or you're really working on a long-running problem, getting therapy is a thing that takes a long time. And that sucks, and I think it's worth spending time on. And good clinicians should be trying to give you as little of it as possible, because good clinicians understand that with more therapy comes more risk and more cost. And we should try to be taking care of all of you, not just our pocketbooks. Thanks for listening. Have a great day.